Hi, I am Dr. Selvaraj, your surgical educator from Malaysia. Welcome back to my series of surgical teaching videocasts. These are meant mainly for undergraduate medical students doing the surgical clerkship rotation. I promise you will become competent in clinical problem solving and surgical decision making if you are going to watch these videos over and over again. Today, in this episode, I'm going to talk one more topic on general principles in surgery, that is blood transfusion. The learning objective of this presentation are after watching this video, all of you should be able to understand the importance of blood transfusion, the types of various blood groups, that is both ABO system as well as the RH factor, blood groups and cross matching, the actual technique of blood transfusion, what is massive blood transfusion, what is blood components therapy, complications of normal blood transfusion and massive blood transfusion, monitoring and documentation of blood transfusion, special considerations in blood transfusion, and any alternative to blood transfusion. So, coming to the importance of blood transfusion, okay, welcome all of you to this educational video on blood transfusion for surgeons. Why blood transfusion is crucial? In the realm of surgical practice, understanding the principles of blood transfusion is paramount for ensuring patient safety and optimizing patient care. In this video, we will explore the key aspects of blood transfusion that every surgeon should know. This includes understanding the blood group types, cross matching, techniques of transfusion, managing massive blood transfusion, utilizing the blood components therapy, and being aware of the potential complications. Above all, our focus is on patient safety. By the end of this video, you will have a comprehensive understanding of blood transfusion procedures, which will help you make informed decisions in the operating room, ultimately leading to better patient outcomes. So, let us dive into the world of blood transfusion and equip ourselves with the knowledge and skills needed to provide the highest level of care to all our patients. So coming to the blood groups, that is both ABO system and RH factor, blood is a complex fluid. Understanding its diversity is vital for safe transfusions in surgery. Blood is classified into different groups based on the presence or absence of specific antigens on the surface of red blood cells. The main blood group systems include the ABO system and the RH factor. The ABO system classified blood into four main types: A, B, AB, and O. Type A blood has A antigens on red cells and B antibodies in the plasma. Type B blood has B antigens on red cells and A antibodies in the plasma. Type AB blood has both A and B antigen on red blood cells and no A or B antibodies. Type O blood has no A or B antigen on red cells and both A and B antibodies in the plasma. This is ABO system. Rh positive person has Rh antigen on the red blood cells, while a Rh negative person lacks this antigen in RBC. So this diagram is clearly showing antigen A. Okay, this is blood group A. So they are having antigen. This is red blood cell, and this is the serum where in blood group A there will be antigen A in red blood cells and anti-B antibody in the serum. Whereas in B group blood group patients there will be antigen B in red blood cells and anti-A antibody in the serum. In type AB, okay, both antigen A and B will be there in the RBCs and no antibody in the serum. In type O group, both A and B antigens are absent in RBCs, whereas both antibodies A and B are there in the serum. Suppose if it is type A blood, they cannot receive B or AB type of bloods, whereas they can receive the same group A and the universal donor O. Similar to that, if it is type B blood, they cannot receive A or AB blood, whereas they can receive type B blood or the O positive blood. AB group can have any type of blood because they are universal recipient. This is the universal recipient, they can receive any blood. Whereas type O can only have O positive blood. Because this is universal donor, they can give blood to anybody, but they can receive only from O positive blood. This is how to find out the blood groups in ABO system and RH factor. Here, add 3 drops of the blood in a clean glass slide like this. 3 drops you have to put there. Add anti-sera A, anti-sera B and anti-sera D sequentially to the first, second and third drop of blood. So add anti-sera A, B and anti-sera D. Anti-sera D is for RH, typing. And then you have to properly mix the anti-sera with the blood by separate toothpicks. So you have to mix it thoroughly. Allow to stand for 2 to 3 minutes and note down the result on the basis of clump formation. So here, suppose if it is AB positive, all the 3 drops we can see the aggregation or the clumps. Whereas if it is A positive group, only the first, that is anti-sera A and anti-sera D, there will be clumping, whereas for anti-sera B, there won't be any clumping. Whereas if it is B positive group, there will be clumping for anti-sera B and anti-sera D, whereas there won't be any clumping for anti-sera A. If it is O positive, there will be clumping only for anti-sera D, no clumping for anti-sera A and anti-sera B. That means this is O positive blood. Then coming to RH negative bloods, that is AB negative, where we can see clumping in anti-sera A, anti-sera B, but not for anti-sera D. Okay. If it is A negative blood, then we can see clumping only in anti-sera A, and there won't be any clumping in anti-sera B and anti-sera D. If it is B negative, okay, there won't be any clumping only in anti-sera B, whereas the anti-sera A and anti-sera D, there won't be any clumping at all. If it is O negative blood, okay, there won't be any clumping in all three drops. So by doing this, we can find out what is the real, the blood group. Whether this is AB 4, that is positive and negative, so totally 8 groups we can find out. Cross matching for compatibility. Cross matching is a critical step before blood transfusion. It involves testing the compatibility between the donor's blood and the recipient's blood. Compatibility ensures that there are no antibodies in the recipient's blood that will react against the donor's blood, causing a transfusion reaction. Knowing the patient's blood type and ensuring compatibility with donor blood is vital to prevent adverse reactions during surgery. Incorrect blood transfusion can lead to severe complications, including hemolysis, that is the breakdown of RBCs, kidney damage, or even death. Understanding blood groups and the importance of cross-matching is foundational for safe surgical transfusion. So here you are seeing this is the upper column. These 4 are donor blood types, O group, and here the vertical column are recipient blood serum. This is mainly RBCs, that is the donor blood, and this is the recipient blood. So if you are going to mix the O with O, okay, there will be clumping. Sorry, there won't be any clumping. If it is donor is A group, then for O positive there will be clumping. In B group also there will be clumping. In AB also there will be clumping. Suppose if the recipient is A group and if it is O group donor, yeah, there won't be any clumping. And if it is A group, here also there won't be any clumping, whereas for B and AB group, there are clumpings. So if the donor is O group and the recipient is B group, there will be clumping. If the donor is A and the recipient is B, okay, there will be clumping. If the donor is B and the recipient is B, there won't be any clumping. If the donor is AB and the recipient is B, okay, there will be clumping. If the donor is O and the recipient is AB, there won't be any clumping at all. For AB, for all, whatever may be, because it is universal recipient, there won't be any clumping at all in all these blood groups. So by doing this is what is called cross matching. If there is any clumping, then you should not use this blood for transfusion. Coming to the technique of blood transfusion, administering blood safely and effectively requires meticulous attention to technique. Confirm the patient's identity using multiple identifiers such as name, date of birth, and hospital ID number. Ensure that the patient has provided informed consent for the transfusion or in emergent situation obtain consent from the patient's legal representative. Maintain a sterile environment during the entire process to prevent infections. Ensure that the blood products are not expired. Choose an appropriate intravenous line for the transfusion. Large bore catheters are often used. Ensure the IV line is primed with normal saline before starting the transfusion to prevent air from entering the patient's bloodstream. Transfusion rate, you can keep it 2 ml per minute for the first 15 minutes to monitor for adverse reactions. Continuously monitor the patient's vital signs. If any reactions, immediately stop the transfusion. Document the transfusion process meticulously, including patient identification, product details, start and end timings, vital signs, and any adverse events or interventions. The technique of blood transfusion is a critical aspect of patient care in surgery. It involves verifying patient identity, using sterile equipment, administering blood through a secure IV line, and vigilant monitoring to ensure the safe and effective delivery of blood products. So this is the blood, okay, they are transfusing it to this patient. What is massive blood transfusion? In critical situations with significant blood loss, surgeon must be prepared for massive blood transfusions. Massive blood transfusion is necessary in cases of substantial hemorrhage such as trauma, major surgeries, or obstetrical emergencies. It is typical consider when a patient requires transfusion of more than 10 units of packed red blood cells within 24 hours or more than 80% of patient volume in 24 hours. Challenges of massive blood transfusion are: number one, coagulopathy risk, hypothermia, metabolic abnormalities like electrolyte and acid imbalance, citrate toxicity, fluid overload. Close monitoring and management, hemodynamic monitoring, coagulation monitoring, rewarming, metabolic correction. Calcium may be administered to counteract citrates' anticoagulant effects. Diuretic may be necessary to manage fluid overload. Massive blood transfusion is a crucial intervention during life-threatening situations involving substantial blood loss. Surgeon must be aware of the unique challenges posed by massive transfusion, including coagulopathy, hypothermia, metabolic abnormalities, citrate toxicity, and fluid overload. Close monitoring and proactive management are essential to avoid these risks and optimize patients' outcome. Blood components therapy. Blood components therapy is a strategic approach to transfusion that offers several advantages in surgical practice. Components included: number one, packed red blood cells or PRBC. PRBCs are primarily used to improve oxygen carrying capacity in patients with anemia or significant blood loss. They are essential to restore the patient's red cell mass. Number two, platelets. Platelets are crucial for blood clotting. They are used to treat patients with bleeding disorder, platelet dysfunction, or those who have undergone create extensive surgeries where there is a risk of significant bleeding. Number three, plasma. Plasma contains clotting factors and is used to treat patients with clotting disorders, liver disease, or other requiring extensive blood product replacement. Number 4, cryoprecipitate. Cryoprecipitate is rich in fibrinogen factor 8 and other clotting factors. It is used in patients with fibrinogen deficiency or hemophilia. Allows for a more precise and tailored approach for the patient. Patient receive the symptomatic treatment, they never reducing the risk of unnecessary transfusion related complication. This approach minimizes the risk of transfusion reaction, circulatory overload, and other complications associated with whole blood transfusion. Consensus of valuable blood products, allowing healthcare providers to provide targeted transfusion support to patients. This approach maximizes the benefit of transfusion while minimizing the risks, contributing to safer and more effective surgical practice. Yeah. Uh, uh, Complications of normal blood transfusion. Blood transfusions, while life saving, are not without risk. It's vital to be aware of potential complications. Hemolytic reactions occur when there is an incompatibility between donor and recipient blood. The recipient's immune system attacks and destroys the transfused red blood cells. Symptoms may include mild fever and chills to severe symptoms like hemoglobinuria, kidney damage, and shock. Febrile non-hemolytic reactions due to antibodies in the donor blood. Symptoms include fever, chills, and rigors, but no hemolysis. Management with antipyretics and in some cases leukoreduction of the donor blood. Allergic reaction can occur due to sensitivity to donor plasma proteins. Symptoms vary from mild hives and itching to severe anaphylaxis. Treatment include antihistamine and epinephrine. Transfusion related acute lung injury or TRALI. TRALI is a rare but severe reaction characterized by sudden acute respiratory distress following transfusion. It is believed to result from antibodies in donor plasma. Symptoms severe respiratory distress, fever, and hypoxia. Treatment supportive care with oxygen and mechanical ventilation may be necessary. Infections, example hepatitis, HIV, transfusion carry a risk of transmitting infections but decrease because of rigorous donor screening and blood testing. Prevention, stringent testing and donor selection protocols. Vigilance, proper patient identification, and adherence to transfusion protocols help minimize these risks, ensuring that the benefit of transfusion outweigh the potential drawbacks. The complications of massive blood transfusions. while sometimes necessary, presents specific risk and complications that surgeons must be vigilant about the massive blood transfusion. So number one, coagulopathy. As large volume of blood are replaced, dilutional coagulopathy can occur, impairing the blood's ability to clot effectively. This places patients at an increased risk of bleeding, which can be particularly concerning during surgery where hemostasis is critical. Management, frequent monitoring of coagulation parameters like PT and PTT and fibrinogen levels. Administration of blood products like platelets, fresh frozen plasma, and cryoprecipitate. Number two, hypothermia. Rapid transfusion of cold blood products can lead to hypothermia, which can impair clotting, increase infection rate, and cause cardiovascular instability. Management use blood warmers and warm blankets to maintain normal body temperature. Number three, metabolic abnormalities disrupt body's electrolyte balance and acid-base equilibrium, leading to metabolic abnormalities. Patients experience hyperkalemia, hypocalcemia, metabolic acidosis, hypokalemia, etc. Correct electrolyte imbalances and monitor metabolic parameters very closely. And number four is citrate toxicity. Blood products are often anticoagulated with citrate to prevent clotting during storage. In massive transfusions, the accumulation of citrate in the recipient's bloodstream can cause metabolic disturbances. Management includes administering calcium, which can counteract citrate's anticoagulant effect. Number five, fluid overload. The large volume of fluid infused during massive transfusion can lead to fluid overload, potentially causing heart failure or pulmonary edema. Careful monitoring of fluid balance and diuretic therapy are needed. Surgeon must be vigilant about the potential complication. Close monitoring, timely intervention, and adherence to the protocols for managing these complications are essential to ensure patient safety during high volume transfusions. Effective monitoring and documentation are vital components of safe blood transfusion practices. Ensuring patient safety is the primary goal of blood transfusion. What to document? Number one, patient information. Accurate patient identification is critical. Ensure the patient's name, date of birth, and hospital identification number match the blood products being administered. Number two, transfusion details. Document specifics about the transfusion, including the type of blood product, volume, and any special requirements. Example, irradiation for immunocompromised patients. Number three, vital signs. Continuous monitoring of vital signs during the blood transfusion is crucial. Document blood pressure, heart rate, respiratory rate, and temperature at regular intervals. Number four, any adverse reactions. If the patient experiences any adverse reaction, document them promptly and accurately. This includes the nature and severity of the reaction and the actions taken in response. Why documentation matters? Traceability. Detailed documentation provides a traceable record of the transfusion process, enabling healthcare providers to review and verify each step of transfusion. Quality assurance. Documentation supports quality assurance efforts, helping identify areas for improvement and ensuring compliance with transfusion protocols. Patient care. Accurate documentation aids in continuity of the care. If a patient requires additional transfusions or develops complications, a well documented history is essential for making informed decisions. Monitoring and documentation are critical components of safe blood transfusion practices. Rigorous adherence to these procedures ensures that patients receive the correct blood products at the right time and in the manner that minimizes risk, ultimately contributing to better patient outcomes. Special consideration. Blood transfusions must be tailored to individual patient needs with special considerations for certain populations. Number one, pediatric patient. They have smaller blood volumes compared to adults. Therefore, the volume of blood products transfused must be carefully calculated based on the child's weight and clinical condition. Some blood products, such as packed RBCs, are processed and stored differently for pediatric patients to ensure compatibility and safety. Geriatric patients, they have reduced tolerance to anemia due to underlying health conditions such as cardiovascular disease. The threshold for transfusion in old patients may be different from that in younger patients and should be individualized. Immunocompromised patients are at an increased risk for infection, including transfusion transmitted infections. Leuko-reduced transfusion can be used to avoid this. Why special consideration are important? Optimize patient outcome. Tailoring transfusion approaches to this special population optimizes patient outcomes by reducing risk and complication. Risk mitigation. Considering factors such as blood volume, tolerance to anemia, and immunocompromised status helps mitigate potential complications and ensure that transfusions are appropriate and safe. Special considerations are essential in blood transfusion decision making. By recognizing the unique needs and vulnerabilities of pediatric, geriatric, and immunocompromised patients, the healthcare providers can provide transfusion care that is both effective and safe. Alternatives to blood transfusion. Hemostatic agents. Number one, hemostatic agents. Hemostatic agents are substances or devices used to control bleeding. They can be topical or systemic. Topical agents include hemostatic sponges, sealants, and adhesives. Systemic agents include antifibrinolytic and procoagulant medication. Hemostatic agents can be particularly useful in controlling bleeding during surgery, reducing the need for blood transfusions. Number two, cell salvage technique or autotransfusion. This involves collecting and reinfusing the patient's own blood lost during surgery. It reduces the need for allogenic or donor blood transfusions, minimizes the risk of transfusion related complications, and ensures compatibility. Valuable in surgeries where significant blood loss is anticipated, such as orthopedic procedures or cardiac surgeries. Number three, pharmacological agents. Erythropoietin or iron supplements can help stimulate red blood cell production or correct underlying anemia. Can be used preoperatively to optimize a patient's hemoglobin levels, reducing the need for blood transfusion. Pharmacological agents are often considered in patients with chronic anemia or those at risk of blood loss during surgery. Number four, minimizing blood loss during surgery. Surgical techniques and technologies exist to minimize blood loss during procedures. This includes minimally invasive surgery, precision instruments, and meticulous hemostasis techniques. Need for blood transfusion can be significantly diminished. Exploring and implementing alternatives can help reduce the reliance on donor blood, decrease the risk of complications, and optimize patient care. Thank you for joining us in this educational journey on blood transfusion for surgeons. As surgeons, your commitment to staying informed and continuous learning is paramount. Knowledge is the foundation of excellence in patient care. By understanding the intricacies of blood transfusion, you are better equipped to provide safe and effective care to your patients. Your role in the operating room is pivotal. You hold the power to make a life saving difference. By embracing best practices in blood transfusion, you contribute to the well being and recovery of your patients. We hope this video has provided you with valuable insight into the world of blood transfusion. Remember, your dedication to patient safety and care is truly commendable. Continue to be vigilant, stay informed, and strive for excellence in your surgical practice. We appreciate your dedication to the field of surgery and patient care. Stay safe, stay informed, and keep providing the best possible care to those who rely on you. So thank you very much for watching this video. If you think that these videos are very helpful, kindly share these videos in your social media. Kindly click the bell button also to get notified regarding all my latest uploads. Thank you once again for watching this episode. Let us meet in yet another episode. Until then, bye bye.